So I wanted to do somewhat of a quick video on my blood thinning injections during pregnancy. Quite a few people actually have to have these, and when I first found out, I was really freaked out about it. I was really nervous about getting a shot every day, but once you start doing it, it's actually not really a big deal. Sorry, I'm like out of breath all the time now. I'm getting close to my third trimester, and I like get winded just from talking. Enoxaparin are the ones that I use. You'll either have Enoxaparin or Lovenox. It's a blood thinning injection, and basically if you have a family history of clotting, if you've ever had a blood clot or anything like that, if you're aware of the condition, a lot of people don't even know if they have like a clotting disorder, then your OB will probably have you on these during your pregnancy. What it does is it keeps my blood nice and thin and prevents clots before, during, and after delivery, as well as helps keep my blood nice and thin so that it's flowing really well to the baby. If blood gets too thick and they're not getting enough like blood flow, obviously that's really not good for you or the baby. So I'm on Enoxaparin, and I'm just going to show you how we do it. Actually, usually you can do this yourself. I don't do it myself because I'm a wimp. I have Matt give it to me. I think if I had just done it, like initially, the first couple of times I would have gotten used to doing it myself, but I got really used to Matt doing it for me. So this is what I use. You're going to need your injection, and things like this, and then you're going to need an alcohol swab, and then my trick, I always use a popsicle. Popsicle for me, you want just like one little area, and it's literally an inch that you pinch and you put the needle into. So this for me is like the perfect width that I need numb, and I do it before because then I don't feel the needle. I was doing it after at first, but like then I'd feel the needle and I just didn't like it. So I would definitely do this first. I also had less bruising when I started icing instead of icing after. And that's all I need. You can ice after the injection too, but I've found that if you numb beforehand, you don't need it. And then I'll have Matt show you how he actually does the injection. This is what they look like, and I don't even look. I kind of look away when he does it, but it's not scary. It is sub-Q, so it's not like going into a muscle. That's the other thing. The spots you want to pick are going to be like anywhere you can pinch, anywhere there's like a fatty area that you can pinch. You can do the back of your arms, like your sides, by your stomach. It has to be like, I think my nurse said, an inch away from the belly button. And there are also some areas that you can do it on your thighs, but I had a hard time finding like areas that didn't have muscle. So I stuck to my stomach, and now I'm on the sides of my stomach. Sometimes I do the back of my arms. If I get a lot of bruising, you'll see that like I got a little bruise here and a little bruise here. So today we're gonna go in between the two little bruises, and tomorrow I'll move to the other side, or I might move to the back of my arm, just depending on if one's ouchy. Sometimes they don't hurt at all, and then sometimes you might mess up. You might hit like a vessel or a vein or something, and then it bruises really bad. So it just kind of depends how it goes. I've had a pretty good streak. I haven't had any bad bruises lately, and Matt's been doing a pretty good job. He's getting better at it too, so that helps because we had a little while there where it was like it's a bad bruising. Anyway, I'm gonna bring Matt in and have him show you how to do it, and I'm gonna start icing an area. So like I said before, you see I have a little bruise here and a little bruise here, so I know I want to go right in the middle. So I'm gonna ice this, and I'm gonna hold it here 5-10 minutes so it's nice and numb, and then I'm gonna have Matt clean the area and inject it. Okay, so I've been icing, and Matt here is going to do the injection for me like he does every night. So you see it's like super numb now, maybe a little too numb, and then he cleans it with the alcohol swab, and then he uses the Enoxaparin injection, and I don't look because I don't like seeing the needle, but you pinch an inch and I'm gonna look away while he does it. But it's really not a big deal after you get used to doing it. And you have to wash your hands before you do it, which is super important. And see, because I numbed it, I don't really feel it. So that helps a lot too. So I really think numbing it beforehand with an ice pop. I've tried an ice pack and I feel like it numbs it unevenly, where when I have that little one, it just really like gets that little area perfect, and then I don't feel like the needle going in or anything.
Then
but
you
it does,
unpinch,
yeah,
and pull.
And pull it out, and that's it. And that's once a day, every day until you're 35 weeks, and then I have to switch to heparin, and that'll be in the morning and at night. But that's only like 4 weeks, and then I switch back to once a day for 6 weeks, and then I'm done. And that's
you
done.
Don't throw these away.
And you don't throw them away. I don't have a Sharps container in this video with me, but you either put them in a Sharps container or you can put them in like a water bottle, and then you bring them to the health department or you bring them to your doctor, and that's it.
Bye.